housing team that we contract with here in the city of Newport Beach. They work very closely with our other outreach teams, such as our Be Well mobile crisis unit that came online in February. They also work with our partners in the county at the healthcare agency and with the psychiatric emergency response team. I'm not going to go over the whole program that they're presenting, but I do want to let you know that we have some materials in the back that have the CityNet contact information on them on one side, and the other side has our messaging about say no to panhandling and say yes to good giving. If you are inclined to give to people that are panhandling in our community, they're less likely to accept services and guidance from our partners such as CityNet. So we just like to message that when we can. We know everyone's heart is in the right place, but it may not be the best way to help that person. The other flyer in the back is our Be Well mobile crisis unit information. They operate in the city 12 hours a day, 7 days a week. You will see their big blue van driving around, and they have become an integral part of our outreach strategy. And finally, the last component, not least, is our homeless liaison officer, Cynthia Carter. Her full-time assignment is to coordinate all of our partner agencies and contractors and provide street-level outreach and guidance, and if necessary, some enforcement as well if there are quality of life issues or municipal code violations. She is an outstanding resource in our city, and her work directly with CityNet is what's making the difference in our community. So without further ado, I'm going to introduce Jessica Bruce. She's the Director of Programs and Outreach at CityNet. We have Valerie Carter, who's the supervisor for our Newport Beach team, and Jess Kelly is one of our 2 case managers. The other person, Brian Moore, could not be here tonight. So thank you, Jessica, Valerie, and Jess.
All right. Can you hear me okay if I don't use the... Oh, okay. Dang it. I hate talking into this thing. Okay. Good evening. My name is Jessica Bruce. I'm the Chief Program Officer with CityNet. Thank you for having us here in Newport Beach to talk about our services. We don't have a fancy van. I'm sorry. We just have a minivan with our logo on it, but you know what? You will see it around your city. We don't need it fancy because we just need to be able to grab a client and take them and get them to shelter quickly. So that's why our van is just a regular Dodge Caravan. But we do have our logos on it, so you will see it. So I'm going to go over our organization overview. CityNet is a 501c3 nonprofit. We were established in 2003 when our executive director was living in Long Beach, and he was at the local parks in his community doing feedings with his fellow church congregations. And they saw that, you know what, we're feeding, but we're not making an impact. And that's when Brad said, you know what, we need to start doing things differently here in the city of Long Beach. And that's how he came to the conclusion to create Kingdom Causes, which is our parent company, and then CityNet underneath that. We started in Orange County in 2013 in the city of Anaheim. We came to the city and said, you know what, we see you have a problem. We will reduce your problem by 10%, I believe, in 60 days if you just give us a chance. So that was back in 2013 when we really didn't do street outreach. I was working for an organization in Orange County at that time, and we were doing street outreach without a lot of direction. We were just going out there, talking to people. Yes? Fast? Okay, I'll slow down. So we found that we needed to get organized with street outreach. So the city of Anaheim said, you know what, we want to be the first program to do that. So we started working in the city of Anaheim. And in that 60 days, we were able to decrease their homelessness, thus leading to a long-term contract with them. So that was our beginning in Orange County. Since 2013, we've expanded our services, and we're serving across the state of California now, all the way from Sacramento, all the way down to the Mexican border in Chula Vista. So we've learned a lot working on the streets in Orange County, and we've taken what we've learned and we've expanded, and we're serving other communities across the state. Scope of work. Our organization has 190 employees. Thus far, we're hiring all the time. So if you know anyone that is looking for employment that would love to come into social services, give them our website. We are always hiring because, as you can see, the need in Orange County and across the state is huge. We're federally, state, county, city, and corporate contracts. We work with Union Pacific Railway, Caltrans, the city. We have county contracts. So all levels of government entities we work with at different levels to make sure that we're covering, the work that needs to be done on the streets to serve our homeless neighbors. Right now in the city of Newport Beach, we've been here since 2018, and we have 2 case managers in a minivan working 5 days a week, 40 hours a week in your city, connecting homeless neighbors to services. And that's kind of what our focus is on in Newport Beach, is just making sure that we're getting all of our clientele knowing that they know how to connect to the resources to end their homelessness. And it can be from, talking with our case managers and going straight to shelter and accessing services that way, or with our case managers working with them over a long period of time. As you know, some of your people in Newport Beach have been on your streets for a lot of years, and we work with them from the streets into housing. And that's a much longer journey that we'll take with the clients. Our mission at CityNet, I gotta put my glasses on because I don't know it by heart yet, is we are committed to breaking the cycle of homelessness in the communities we serve by connecting neighbors experiencing homelessness to transformative care and innovative housing solutions. So we are housing focused. Street outreach, it's hard to house people directly from the street, so that's why we try to get them connected to the bigger system through the shelters. But we are housing focused, and that's our goal for all of our clients. So even when they enter into the shelters, we're walking with that client even though we do a warm handoff to the shelter provider, we're still available. I know Jess goes to the shelter still and checks on our clients to make sure that they're there still, and we make sure that the case manager on the other side has everything they need to connect that client to that long-term housing plan, because now they're in the shelter and now we've done that warm handoff. Some of the programs that we've done at CityNet, street outreach and engagement is our #1 service. From there, we've expanded into to police diversion programs. So in the city of Anaheim and Santa Ana, we work there. They have a bigger population of homeless than the city of Newport Beach. So we're in their cities 7 days a week, 14 hours a day, and responding to police dispatch calls from their police departments to get those calls off of the police officer's responsibility into the hands of a social worker to connect people to services. Housing is our goal for all of our clients. So we've done emergency shelter, bridge housing, and a lot of the motel programs, especially over the last 2 years with COVID. There's been a lot of opportunities to bring in new programs and like the motel projects. Our teams provide housing navigation, like I was saying, we're housing focused. So if the client wants to enter housing, we will work with them from the streets into housing. We provide permanent supportive housing services, which is those individuals who move into housing, supporting them once they get into housing so that they retain their housing. That's our biggest mission, is once you get into housing, it doesn't stop there. We know that we need to walk with them a little further to make sure that they stay in that housing. And being a full partner in permanent supportive housing is really imperative to the work that we do. Another service that we provide in Orange County is HDAP. A lot of the clients in Newport Beach have been fortunate enough they've come to us and said, I'm eligible for Social Security disability benefits, but I don't know how to do it. So our teams are Jess is able to pass her clients on that are eligible for Social Security disability benefits to our team that works with clients on long-term benefits, and we're able to help walk them through that process. And I don't know if anyone's ever applied for disability. It is not an easy process. You usually get denied the first time, and then you have to appeal it to get it. So it is a long process to get these clients long-term financial means. And the last thing that our agency does is censuses or point in time. So as you know, the County of Orange does a big point in time every year where we go out and count the homeless, or every other year, per HUD. But we also do censuses for cities. And so in the city of Newport Beach, they like to keep the pulse on what's going on in their city. So we work with them on a yearly basis to do an extended point in time in the city to see who is on the street, so we can create a by name list or a takedown list that we can watch and monitor every year. Who are the same clients that we're seeing on the list, who are dropping off, and who are our new neighbors. So that's a little bit of an overview of CityNet. I'm going to pass it on to Valerie Carter. She's our regional program supervisor, and she's going to talk about street outreach.
Thank you.
You're welcome.
Good evening, everyone. To go into what street outreach is a little bit further, just to give us all an idea of what a service plan might look like, or just a brief overview of what it could look like. So we are out in the city Monday through Friday. So on a daily basis during the week, we are meeting folks where we already know them to be. And then we are also working with Officer Cynthia Carter to identify those that maybe we don't see totally easily during the day, but in the evening when the police department is out and about, they might meet someone that we have not yet met. So the communication between them and our case manager teams is pretty seamless, and thankfully we're able to reach those that we may not see during the day. So it's a good connecting relationship there. Case management. So this entails each of the processes that the county has put in place to get individuals in need connected to housing opportunities. So there's kind of two-ish, or I'll say two or three main categories of housing opportunities that those that we serve might potentially get connected to. So one of them is called a rapid rehousing program that refers to a temporary financial assistance program that is able to pay for something like security deposit, first month's rent, and then maybe a few months of rental assistance to help with that initial move-in costs and help the individual get stabilized with that initial temporary amount of care. Not everybody needs a whole entire housing voucher. They don't need something like Section 8. There is an amount of the homeless population in this city and all over Orange County that just need that initial push and that initial encouragement to be able to sustain themselves again. There could have been any type of crisis that led to their homelessness, but it may be their first time in the last couple of months, and we don't want them to stay houseless. We want to connect them to the most appropriate housing opportunity. So rapid rehousing is a fit for somebody like that. We also have permanent supportive housing, which are identified units all over the county or in different places in the county, and they have supportive services for those that are living in those identified units. So they have a service provider that is usually on site at the apartment complex, and those are for individuals that may need a higher level of care. So those that have severe mental illness, potentially substance or alcohol abuse. Those aren't deal breakers, so to speak, for eligibility for housing. One does not need to be clean or sober in order to deserve housing or be eligible for housing. It is oftentimes much easier to help them work through that hardship when they have a stable roof over their head, right? So that is an option for those that might have either of those issues or both at the same time. We see that as well. The other thing are emergency housing vouchers. So that is a large batch of housing vouchers that is very similar to Section 8, where the participant will pay 30% of whatever their income is. So income can fluctuate. It would fluctuate with their income amount, and they would pay 30%, and the housing authority would pay the other portion of the rent. So they would pay the balance of the rent. So those are three main housing opportunity types. And when it references the coordinated entry system, that is the system that meets together on a weekly basis and matches individuals to housing opportunities based on their disability level as well as their length of homelessness. Some other case management activities would be shelter referrals. Two of the main ones that we refer into when we are working with folks sleeping outside would be the Yale Navigation Center, which is located in Santa Ana, but it is designed to serve any homeless individual or couples that are in what we call the central spa. So that's central Orange County. There's also the Costa Mesa Bridge Shelter, which the City of Newport Beach has designated funding for 20 beds at that shelter. And we're able to directly refer into there. So we work with Officer Cynthia Carter to designate or to confirm ties to make sure that they are actually connected to the City of Newport Beach. We wouldn't want to use that resource for somebody who maybe just got here and doesn't have a history here or is from some other city altogether. I talked a bit about housing, so this is always going to be our main goal. Sometimes there are more steps than others to get directly to that housing opportunity, and those are some of the things that I've already mentioned. Sometimes diversion is the route that we take with individuals that we meet, and that can be a conversation where we're asking about any family or friend support, not in this immediate area, but maybe they have support out of state or in another county and they don't have the resources to get themselves there. So diversion and relocation is most often how we refer to it. That would be us purchasing a Greyhound bus ticket or a plane ticket when we've identified on the other end, wherever that may be, that there is a viable housing solution for them. So that can be a family member, that can be friends, but we are making the call, the case managers are making the call to that person on the other end, verifying addresses, verifying that it's a viable option. We would not want to send somebody somewhere else if we don't believe that it's a true option for them and for an extended period of time. We also address some physical health, mental health, and then we try to refer into detox programs or recovery programs when they express that they are in need of that. It's not uncommon for us to meet someone on a Wednesday and they are telling us they don't want anything having to do with us, they don't need our help, but we see them there the next Wednesday, and maybe we see them there the next Wednesday, and we are at least a smiling face. We give them a water bottle, especially in this heat. We have little tools to help us connect with them, and building rapport is a lot of what outreach is. And, I would expect that if I'm asking somebody for something, I really want to be able to trust them. And the way to build trust is to build a relationship and build rapport. So that's a lot of what our team does, and that's something that they are really great at. And it takes an individual on our team who is invested in the citizens of Newport Beach to take the time and continue and be persistent, even when we may get the door slammed in our face more often than not. We are a persistent team, and we have positive outcomes because of that, I think. So just to go into a little bit more, I mentioned these resources already, but the Yale Navigation Center is a relatively new shelter in our county. And again, it's in the city of Santa Ana, but it is serving all of central Orange County cities. So they have a capacity of 425 beds. I will say, though, that because of the pandemic, they have yet to operate at full capacity. So that's really kind of I'm trying to think of an average because the number of beds and their capacity fluctuates based on any outbreaks in the shelter or various other issues. But I think maybe they're hovering around 200 beds occupancy right now. It could be a little bit higher, but more so recently in the last month, they've started to actually consistently open beds. So thankfully we're able. I believe it's due to OC Public Health. Yeah. Yeah, so they're not able to operate at that full capacity. I already mentioned the Costa Mesa Bridge Shelter, another attainable shelter option for some of our folks. Right now, we've got all 20 beds designated for Newport filled, and it stays that way relatively consistently, but we work with Natalie, Officer Carter, in monitoring that so that we know once a bed opens up, we have somebody already in the pipeline ready to go. Natalie already talked about Be Well OC, but our team and their team has developed some really great working relationships, and they do their thing with mental health crisis stabilization services, but we also work closely with them if they happen to be in town where maybe we just left, but we heard of a client that's in need of something. We can pick up the phone and connect with that team, and vice versa. We have different hours and different relationships in the community, so we work together to serve those that need it. I wanted to talk specifically about our collaboration with the police department, specifically with Officer Cynthia Carter. So these are some of the things that we do on a regular basis with her, but really she is such a gem, and I have worked and currently work with many, many other police departments in the county, and she really is a cut above, and she is so invested in this population that we are both jointly trying to serve, and she is so effective in the way that she communicates and connects well with these clients, and it is wonderful to have a homeless service provider like ours, like CityNet, be able to come into a city and have somebody be so open and invested in doing the same work that we're doing. You don't often find that in a police department, but here in Newport Beach, we're blessed with Officer Cynthia Carter. So these are just some of the things that we do together, and it really is helpful. Again, just kind of when we're on different schedules sometimes, she works later into the evening than we do, but she knows what goes on after we leave, and we know where to pick up the next morning. And it's as simple as text messaging and calling each other whenever we need to. And we have regular days that we travel out together. Case managers will hop in her patrol vehicle, and and or just follow in our minivan, following her patrol vehicle. Let's see. Next. This is just some statistics for our agency as a whole. So this is since 2014. We've had over or close to 12,000 street exits. So street exits can mean many different things, but this means that somebody was on the streets in any one of these cities and they are no longer. So we're really proud of this number. We are really proud of the work that we do. And street exits, again, refers to many different things, but really that means they are not visible in the community like they used to be, and hopefully they are connected and on the track to becoming stably housed. Are we okay with questions now, or do we want to? Okay, go ahead.
Just back on those statistics of, and I'm thinking on Newport Beach because that's why we're here.
Right.
Of the 135 that have been housed, are any of those repeat, or are those unique individuals?
That is a great question. Do you know? Alrighty, moving along. So this is the report from just last month. So you'll see here that it indicates we had 4 street exits. 2 of those were to shelters. So one of them was to the Costa Mesa Bridge shelter. And then we actually were able to get another individual into the Huntington Beach Navigation Center, which is a little bit abnormal because we don't usually see folks from Huntington coming here to Newport Beach. But in this situation, they did happen to have ties to that specific city, and we were able to work with the team over there to connect them to Huntington Beach Navigation Center. We also had 2 other exit destinations. One of them was a really unique situation. This the one that's listed as foster care home or foster care group home. So this ended up being a minor who was found in the city with someone who was not her guardian or parent. So we ended up needing to intervene and get her safely to a place where she was going to be much more safe than we found her. So that was a very unique situation. And then the last one, the rental by client with no ongoing housing subsidy. That was a young man. I believe he was early to mid 20s. We met him. He was sleeping in his vehicle. He had 2 dogs, and he was able to, just with some encouragement, we weren't able to connect him to a financial resource to help him get into a place of his own. But again, through encouragement and relationship building and giving him some pointers about what to do when you apply for a room rental or a unit on your own, he was able to find a room rental that worked with his budget and was able to move in after about, I believe, a month or so of us coming into contact with him. He's somebody who had never touched a homeless service provider agency before, newly homeless, but this is an example of it being possible to become housed again without public programs. And I would say that this is a rarity, but this is something that is wonderful whenever we see it happen. So the red dots just indicate where our meeting where the meeting locations were. We had 16 new engagements and then 71 contacts total. I do want to mention here that many clients that we work with in this city they're not always interested in getting into shelter. And when they're not interested in getting into shelter, that means that we're doing longer term case management with them that requires more time. So we are picking them up from wherever their sleeping spot is. We're taking them to social services. We're making sure that they're connected with GR or SNAP or any other public benefits that they might not have been able to access on their own because the system's too complicated or because they didn't have the resources to get from point A to point B. Maybe, they just only know a small space, and we are here to pick them up. We put them in our minivan. We're able to safely store their items while they're with us so that they don't get stolen or whatever else may happen if you leave stuff behind. But there are many clients in this city who we're working with on a long-term basis, and those require extra time. It's not just a simple pickup, drop off at shelter, and then we do the warm handoff. So all that to say, the number of contacts may look a little low to some, but that's because of the time that we're spending with individuals, getting them to all of those little steps while they're still sleeping outside. And next, I am going to pass it to Jess Kelly. She is one of our case managers to share some success stories. I think maybe some of you will recognize these names, but this is the team and one specific client that Jess will share about.
Hi, everyone. So Marlene, she's a woman that we met here in Newport Beach. She had never experienced homelessness before. She worked in contracting, and due to whatever reason, she was laid off. And after using her savings, she found herself living in her car. So she made contact with us. She did not know what GR was. She didn't know what SNAP benefits were. We were able to take her that same day and get her those benefits. We stayed with her. We advocated for her. They tried to set an appointment for us to come back, and we said, no, this is an emergency situation. She doesn't know where her next meal is coming from, and we stayed for about 3.5, 4 hours, and she was able to leave there with SNAP benefits so she could buy food that night. While that was going on, we also collaborated with Officer Carter, and who happened to be out with Natalie. And this woman had a job interview coming up that week that she was able to show us the email. So they were able to put her up in a motel room so she could shower and do laundry, and we helped her out with gas money to get to her job interview in LA. So that was a really awesome situation. This next client is a male who became homeless shortly after the pandemic. He typically stays around the pier, and he was one of the ones that shelter just wasn't such a great match for him for whatever reason. He does struggle with mental health, and he would end up back in the pier area. So we worked with him on long-term housing. He was able to get connected to a voucher, and he was recently accepted into an apartment, and he is moving in 2 weeks. So he's very excited about that. The last woman is somebody who we found just recently at the pier, and she also struggles with mental illness as well as some cognitive delays. She's very vulnerable. She has almost a childlike naivety to her. So we really wanted to get her off the streets fast and get her into shelter. From the day we met her, we were able to get her into Yale Navigation Center. I think it was 2 days later. When we went to find her, she was laying in the sun. She didn't have water. She didn't have food. As soon as we saw her, we were able to give her water. We transported her to the shelter, and they fed her right away before they even did the intake. So that was also a very quick experience where she is now at the shelter, where she has a safe bed at night. There's another woman who's not on here that I also wanted to talk about. She has a full-time job here in Newport, and after her mom passed away, she could no longer make the house payments, and she found herself in her vehicle. She contacted us, and within a week, she got matched to an emergency housing voucher opportunity. And I just got a phone call from her today that she found an apartment, and she's waiting on her move-in date, which should be within the next few weeks. So that was very exciting too. So that's all. Thank you.
So that's a little bit about our organization, and we're open to questions or comments or anything that you would like to talk about. Okay. Yes. Oh, do you want to?
Thank you. Thank you for the presentation and for all the amazing work that you're all doing. I just wondered if you could talk a little bit more about this length of homelessness that you mentioned. I think Paul kind of touched on the repeat numbers that we're seeing. It's hard to get a sense of the statistics, like how many people are refusing the services that are being offered just flat out. how many of them in the last point in time count were here previously? Because I think you mentioned that that was something that you track. How many are new to the city? How many have just been here, for the last several years? Can you just kind of elaborate on some? I know that was a
That's a very deep
multi-pronged.
dive with a lot of questions, and it's really great questions. And if you offline, give you more of that information. But we do a census in the city of Newport Beach, and we do comparison of who are the rollovers. And if I, I have it in here, but I can show that. I can share some of that with you. But with clients and the refusals, we, as service providers and as people that have committed our lives to social services, when people say service resistant, that just makes my skin crawl, because I don't think they're service resistant. They're service shy, or service scared, or service disappointed because they've been offered things and it didn't happen. And when we go out there, we don't promise anyone that you're going to get a housing voucher like that lady that got one like that. That doesn't happen very often. And we don't promise that. We say, we'll walk with you on the journey to housing. But into the fact that who say no, our motto at CityNet, and our little case manager down in San Diego has been quoted 3 times in the paper in the last 2 months. If today's no is tomorrow's yes. So like Val was saying, going out and engaging individuals, and that just seeing that face, it's kind of like when you go to the grocery store and you see the same checker every week, that person, then you start talking to them and then they start opening up. It's the same with street outreach. We go out there, and a lot of these individuals are, if their mental health that day is not well, then it might not be the day, and it might be the day just to hand a bottle of water and leave a business card, because maybe they'll get a sense and they'll have a phone and they can call us. But it's really that consistency of coming back and re-engaging and letting them know that we're here, we're not going away, and we want to be the conduit to your long-term housing solution. So that's really what we focus on. So all of our data, we do collect the no's, because even if we see Johnny in the red t-shirt, in our system, we use the county's homeless management information system, because we want all the data to go in one place. So that way, if we put in that we saw Johnny red shirt, and then another agency who sees Johnny red shirt, we all are collecting that data that we've engaged with him. But really, we collect the data on the no's so that we can get to a yes and start working with them on that long-term plan. Yes.
Thank you for your presentation, and what you do is very, very important. And I was out in that point of care count with, I think it's Cynthia, both in the morning and night, and she's a sweetheart. She's a wonderful person. The first question I have is, of the people you come in contact with, how many can you offer at the very point you're in contact with shelter that night? What percent of the people can you say, I can take you to a shelter tonight?
Giving you an exact percentage right now would be very challenging.
Guess.
Challenges such as during COVID,
Well, average.
shelter would close down
Yeah.
for a good period
Well,
of time. Or
Yeah, but give me just guess. What percent can you offer shelter right now that you come in contact with? In other words, I'm leading up to the Martin versus Boise decision, which I'm sure you know exactly what that is. And so that question is very, very important with respect to what the 9th District Court has decided.
Yes. So, every day we get a shelter bed availability, so we don't know.
Well, a guess. Is it
30%
5%? Is
probably.
it 50?
I would say 30 to 40% of the time there is a bed available.
Say that again?
30 to 40% of the time?
You can offer somebody you come in contact with 30 to 40% of the time.
Yes, there is a bed available. Yes, 30 to 40%.
The other question, now you're in 162 cities or 162 districts or whatever you put up there. Do any of the cities today meet the Martin versus Boise requirements?
Yes, the city of Anaheim meets the requirements. They have created enough shelter beds in North Orange County for them to be able to enforce if after a shelter bed is off.
So they can enforce their anti-camping laws?
Yes.
Do they enforce their anti-camping
No.
laws?
No, honestly, because all of our cities right now are trying, and across the state for us, are trying to change their delivery of services. So unless you have a tent up, then they're going to do a little bit heavier enforcement if they're eligible to, but most of our cities are not, because to meet the Martin versus Boise threshold, you have to have 60% of your homeless population 60%. So if our number is 100, we would have to have 60 shelter beds to be able to enforce in our city.
Well, Huntington Beach put up, 200 beds in several months in that tent, and I believe that's still doing well. I mean, do you think 20 beds for Newport Beach is adequate?
I'm going to pass that one to Natalie.
So the question was, is 20 beds enough for the city of Newport Beach? Part of the shelter, I will answer that, but part of the shelter operations is to get people into the shelter, stabilize them, and move them to their next opportunity. That way we will have a flow through the shelter and not have the same person on the street, the same person in the shelter, and no movement to get everyone the services they need. That being said, we are trying to see if there's somewhere in the county where we can add more capacity. I go to our shelter at least once a week. It is physically built out to its capacity with the 70 beds. I've walked the dorms. We've tried to see if there's some way to reconfigure. They are at capacity. We've already reached out to the county for the Yale Navigation Center. If they ever come online with all 425 beds, would they be willing to set aside beds just for Newport Beach? Jessica was very helpful getting me that contact so we can make that connection and that relationship. And then finally, we have reached out to Huntington Beach. They want their shelters strictly for people with Huntington Beach ties. The rare time CityNet has been able to get somebody in there, it's because they have a Huntington Beach photo ID from their last known residence, and they happen to be in Newport Beach while the CityNet team was doing outreach. That is very much an alive discussion about adding more shelter capacity. We just haven't figured out who will partner with us for that.
Hi. Twofold question. Number one, how many of the people that you encounter in the streets have phones, cell phones?
That is a challenge that we face regularly. I would say maybe 60%
Yeah, that's what I would say.
people have phones. When they don't have phones, that's a service that we'll provide. We will take them to the social services office or one of the tents that are set up. As long as they have SNAP benefits or GR or Medi-Cal, a lot of times they qualify for a free phone. So we will take them and walk them through that process, and we'll bring them back when we're done.
Great. Second question is a typical day for a case manager. How many new people do you tend to encounter and or talk to?
I would say lately we've been talking to new people pretty often. I would say maybe 3 to 4 days a week we have at least 1 to 2 new people on our calendar to meet with. And these are just people that are calling in and making appointments. Yep. We also see new people when we're out doing outreach as well.
Wonderful.
And we've seen we've been in Newport Beach now for 4 years, so we've seen the ebb and flow. Summertime, we're going to see a lot of new faces, and then wintertime, we see they go away.
And there's a lot of times where we do see a new face because they're here for the day, and then we never see that person again as well.
Over here.
At our church facility, we frequently see people very early in the morning or later at night or on the weekends, outside the hours that I believe you operate. What do we do?
That's not a problem if you reach out. Oh, she's asking that on their church property, they see people early in the morning and late at night. And we're not here during those hours, so how do they connect to those clients? So that's not a problem. We have the ability, if Natalie says, hey, we need to have an extra outreach early in the morning. These guys are great. They will get to the church at 6 a.m. if needed. So if you work with Natalie and she, we can coordinate the schedule and we can be there, one day a week at earlier times. Because I'm sure by the time 7:30, if you have an 8 a.m. mass,
Right.
people are starting to leave. So we make that accommodation with the cities. We just, whatever Natalie says, we do.
Okay, thank you.
She's the boss.
Thank you. This is the first time I've come to a meeting like this, but I think this might be the first meeting. Thank you for your work, and I get the impression you're an umbrella organization, and you really have no control over what any city does or necessarily any influence. And I live in Newport Beach, and I'm appalled at what is going on with our government and what the resources they're willing to commit to the homeless. I think it's a disgrace. Have you ever made a presentation to our city council?
We have, and I 100% agree with you. That's why on one of the slides on here, outreach is only as good as the resources that the county and the cities provide. So we're great, and she's amazing.
No,
and she
I think you guys are
yeah,
terrific.
but you're right. We're only as good as the resources that the bigger system has. And yes, we go. Our vice president is on the homeless commission. He's on the continuum of care board. So he's advocating all of the time for those services. And when we come to cities, we talk very frankly with them about what we need so that we can end homelessness in their communities.
No, I understand that you're good guys.
No, but yes, we do go to council and we do advocate, yes.
Right. I guess what I'm here and I'm thinking, we should have a citizens advocate group for the homeless, and that we petition our council persons, whatever city we're in, that we make our voice heard, because no one's out there, as far as I know, saying homelessness is a disgrace in my community or your community, and I want it stopped. And I guess I think to myself, Warren Buffett said, we're a rich country, and a rich country can take care of everyone. It's just like a rich family can take care of their family. And I feel we're just dropping the ball. Thank you.
Hi, and thank you so much for all your work. It's a big problem, and I know there's so many different ideas on helping people. Can anyone tell me I remember when Hoag partnered with St. Joseph's, and it had to do with the Fairview State Hospital closing down. And I believe at that time when Hoag partnered with St. Joseph, all the mental hospital, let me say this correctly, the beds that were supposed to be reserved for the mentally challenged were eliminated and were supposed to be open at Fairview. When Fairview reopened, it was supposed to be a big a big plan for people to come in that were homeless, and it was supposed to have people going to, certain areas to get retrained. Whatever happened to that? Thank you.
I'll take that one also. So the Fairview property is state property, and the city of Costa Mesa is actually taking the lead to try and repurpose that property for some kind of permanent supportive housing. What we have been told is that the property does not have proper up-to-date infrastructure to even move people in right now. They were decommissioning the few residents that were there to empty the site, assess it, and then see how to best use that site. That's not out of options yet. It's just that we haven't gotten any direction from the state to the city of Costa Mesa as the city in which it's contained to move to the next step. But that is very much a conversation that is occurring in the region.
I just had heard that the developers had already gone in there and, gotten their chunk of land to do it seems like the ball's been dropped somewhere.
Yes, it's at the state level right now. It hasn't even been formally proposed to the city of Costa Mesa, what could be done there.
Thank you. I have a couple of questions. The first one being, obviously, you're working in a number of cities, as a few people have touched on. And I'm curious to know what successes you're seeing in other places. It sounds like Anaheim has met their requisite bed count to meet the Boise case requirement to enforce whether or not they're actually enforcing, obviously, is a policy decision for that city. But generally, are there cities that you're seeing more success in? Because I know when I looked at the last point in time count, Newport Beach's numbers were up 50% versus, for example, our neighbors in Costa Mesa, Laguna Beach, Huntington Beach, I think we're down 20, 60, and 35% respectively. So it's not for lack of effort on your part and on Natalie's part. We're doing a lot. We're spending money, but you're the experts, obviously, so I'm curious what your take is, what we should be doing, what we could be doing.
Yeah, the point in time is a hard discussion just because it's a point in time. And there was, we were the organization that runs it for the County of Orange, and 2 years ago we had an amazing count. We had a great outturn of volunteers and we got great numbers. And this year, the numbers are what they are, but it fluctuates, and it fluctuates on who's out doing the count, and like LA County, their numbers are down this year by 1,000, and so everybody's seeing a huge fluctuation in those numbers from the pit that we did this year. The City of Newport Beach, within our services and in our contract, we provide them a census, which is a deeper dive, and we did one for them 2 years ago. We did not do one last year because of COVID, but we've done 2 censuses, and we are scheduled to do another one in the fall of this year, where you'll come back probably around December and you'll get a deeper dive into your numbers in Newport Beach, and you'll get to see how many clients are the repeaters, that have been here since we've been here since 2018, and we'll have a deeper dive into that data discussion, and so you'll be able to see that. But right now, what's working, we've got to start at the basis. So you're seeing HUD bring in a lot of new funding for street outreach, because historically HUD has never paid for street outreach. Cities and counties have had to use their different funding sources to supplement that for us to be able to do the work that we're doing. So they're investing in street outreach, which is number one, so that we can get people dock ready to get connected to the bigger system of care. And then we're seeing more shelter beds come online. Our agency does shelter operations. We do non-congregate shelters, so like tiny homes, like your little pallet villages, which we don't have the land here, so we do that in other regions, but we're seeing a lot of communities bring up the shelter bed reservation systems with more beds online, because we have to be able to get people quickly off of the streets and into the system of care, and shelters that way, because this walk from street outreach into permanent housing, as Jess can tell you, it's a long walk. So really what we're seeing is that we're building our infrastructure still. I started this back in 2006, this work. In 2010, we had the HERTH Act, and it was going to end homelessness in 10 years. And that hasn't happened. And I think we've learned a lot from setting those goals of we don't have the infrastructure to be able to do that. So my goal and my mission in my life is to see our cities and communities get to functional zero. Where we have if you want a shelter bed and I see you and you say you want a shelter bed and you say yes, I can take you. If you want to go into permanent housing, then we have that opportunity. If you're a veteran, we need to widen our toolbox and bring in more resources, so that from the streets, from the shelters, we have resources to offer them. And unfortunately, we're still back in 2014, 13, trying to build all those resources, and we're still waiting for those resources to come online. But really, we're still building.
But let's say we had those resources in place. It sounds like there's still a pretty big number that's unaccounted for that would refuse those services and would prefer to stay on the street.
I wouldn't say that, because we have one shelter type in Orange County to offer clients. We have congregate shelter. And like I said, our agency, we do non-congregate shelter settings in different regions. If I go out and offer a client a motel room or a tiny home, 98% of the clients will accept it right then. Let's go. But offering a congregate shelter bed is challenging, and it's the only resources we have. So we have to sell that as hard as we can. Hey, get into the shelter. It will hopefully it will help fast track you through all your processes to get into housing. But our toolbox for housing right now and options is so small. We only have one option. It's congregate shelter. That's it. And honestly, if you've been homeless for 10 years and have mental health, being in a room with other people is not going to do well for you. So really what we need to do is we need to broaden our portfolio of options for people so that we can say, okay, you're okay. You want to be in congregate because you like being around people, but you don't want to. So, okay, we're going to put you here. So that's really what we're working on, is just building a portfolio so that there's multiple options for people and it's just not one option. And that's kind of where we're at right now, is we have one option. You go to congregate shelter or you stay on the streets, and we work with you to get into housing from there.
But there are other cities that are having kind of more success, it sounds like, or at least according to the last point in time count, as accurate as that may or may not be. So you mentioned the countywide system. Do you have a sense of how many people are coming to Newport Beach from other areas in the county that may have been counted, someplace else, maybe in Anaheim, maybe in Costa Mesa, the last time?
At the point in time, they do ask what was your last permanent residence, but it doesn't, in the data captured, that data doesn't take that client back to that city. And that's a problem I have too, because, if you're from, let's use a city that I don't work in. If you're from Huntington Beach, and you're located that's about one because we got somebody in shelter this week. Okay, so if you're from Garden Grove and we find you in Newport Beach, yes, your ties and your last residency is from Garden Grove, so you're eligible for resources from there, but you're standing here in this city, and so we've got to find resources that you're eligible for standing here, which is the Yale bed. So it's very convoluted in the way that we do this, because every city wants to know where their ties are from, so that their tax dollars and their monies from their cities are going to their own residents. But all of our cities don't have the same resources, so people go to different locations. And some people will come to a city that doesn't have a shelter because they can hide and they know they're not going to get bothered. And so that's why some cities will see an increase in numbers, because there's no resources and they can't do anything, and so they'll go hide in those cities. But really, CityNet, and when we do street outreach, we are in your city. If we find Johnny and he's not from your city, then we're going to work with him anyways, and the city wants us to, because he's here now, and we've got to find a long-term solution to him regardless. The resources like the shelter beds, we're going to use the county resources, to get into those types of things, but, not using the beds paid for by the city. But we really need to be able to offer them somewhere to go, regardless of their ties being from the city they're standing in, or from the city next door, or from next door state.
Thank you. I just have two more questions, and then I'll give up the mic. One for you and probably one for Natalie. Can you talk a little more about the young girl that you mentioned earlier? I've heard rumors that it was a trafficking situation. Sounded very unfortunate. Just curious if those were rumors or if they're factual. And then the other question I had, again, probably more for Natalie, is about Our Lady, Queen of Angels. I think I've heard that they offer some handouts of some kind. I don't know if it's bus passes or phones or other things. That seems to be a bit of a draw for people to go there. And as a parent, obviously that's a concern for me, right next to CDM high school and middle school.
Thank you.
So the first situation that Lauren mentioned is actually very noticeable in the Tulsa, Oklahoma media. This was a case where a 16-year-old was groomed and then brought to Southern California. CityNet, Jess, was actually our first point of contact with them, and they presented as a father and daughter that were down on their luck in California. Summertime, school's not in session. We thought we would see what California is all about. Jess realized something didn't sound quite right. I happened to be out with Officer Carter that day. Jess called us, we met the people, and turns out he had brought her from Oklahoma. So by the time our police did a tremendous amount of detective work and police work, they were able to separate them, verify stories, and ultimately shelter the young woman to get the help she needs to reunite with her family. And the man is facing extradition to Oklahoma if and when he has another contact with police. So if you really want to do a deep dive, the story is in the Tulsa Fox News media. Yes, ma'am. So the question is, what is the percent of people that are truly mentally or because of substance abuse use impaired? We're actually getting a better handle on that now that we have our Be Well mobile, because of the car. Now that we have our Be Well mobile team assisting our other outreach teams, we're trying to determine that and see how we get somebody to go through the proper channels of care. If I'm not a clinician, my degree is sociology. If I had to give an educated guess, I would say probably 50, 60%. Now, bigger picture, these examples of people that lost their home, wound up in a car, trying not to go on the street, that adds mental anguish and stress and can make somebody make poorer decisions. If they only have this option and they don't know the CityNet option and the Be Well option, we see people that get into worse circumstances and compromise their mental health or generate a physical health problem. So our goal is to reach those people as soon as possible and connect them so they don't have more barriers to receiving that service. So hopefully that answers as far as the mental health piece, but that's where Be Well specializes in mental health and can de-escalate so they can focus on what CityNet is offering. Let me answer Lauren's second question. So Our Lady Queen of Angels, which is over by Corona Del Mar High School, they operate a Helping Hands ministry. They have very limited service hours, but they do help people in need. You don't have to be from Newport Beach. There's actually a bus stop right across from the church. They do provide limited gift cards, gas cards, and in one rare instance, they actually helped us with a security deposit. I don't know if you may have heard this story a few years ago. We had a mother and daughter living in their vehicle at the church for 10 years. Daughter was 67 years old. Mother was 97 years old. So once CityNet got involved, we contacted Helping Hands Ministry. We pulled this all together. We were able to house them in a senior apartment in Tustin. And the daughter is still there. The mom has passed. But that's an example where Helping Hands actually was the key to solving their homelessness. Yes, it can be a draw to bring people into the city. They have a very small footprint. They don't do advertising, but it is a church, and they do feel like that's part of their mission to do what they can in our community. Good question. Do you want to take that? Okay. Yes, I'll take it. Okay.
In Newport Beach?
I can take a stab at it. So there is a specific category of people experiencing homelessness called transitional aged youth. That tends to be 18 to 24-year-olds that have either aged out of foster care, they might have been released from juvenile detention, or they're just unaccompanied minors. We run across that very rarely, I'd say maybe 1 to 2 times a year in the city. So when we do have that, actually, we can place people, we can connect them with Stand Up for Kids. We work with Project Hope Alliance, which operates in our school system here in the Newport Mesa School District. So there is a safety net for transitional aged youth. We just don't encounter it very often at the street level.
We've added more stay beds. Covenant House has come online. We have a youth shelter in Anaheim for youth. Unfortunately, our transitional age youth, down in Mission Viejo, they're really rich for this because it's all about college. But we find that our TAY population is hidden because they're doing a lot of couch surfing. They'll sleep in their cars, and they think they're going to get in trouble, so they hide. So we really, I know that the TAY subgroup in the county is working hard to better identify our TAY, because we have funding sources. It's just they're our hidden population because they just want to stay under the radar and not get caught up on things.
Are there any other questions for CityNet? Well, I thank you all for attending. Again, our next presentation will be in October, and that is our Be Well Mobile Crisis Unit. And then in mid-November, we have the CEO of Share Ourselves, our guardian angels over in Costa Mesa. So I look forward to seeing you there, and thank you very much for attending.